How are non-fasting cholesterol results interpreted? Imagine going to the doctor and getting your cholesterol checked without needing to skip breakfast. Many people find this more convenient, but how do these results compare to traditional fasting tests? When you have your blood tested for cholesterol without fasting, the results are still useful for assessing your heart health. Total cholesterol and high-density lipoprotein cholesterol, often called good cholesterol, stay pretty stable whether you've eaten or not. So, these numbers can reliably tell us about your risk for heart disease. Low-density lipoprotein cholesterol, known as bad cholesterol, and triglycerides, which are fats in your blood, can change a little after eating. Usually, these small changes don't make a big difference in understanding your overall risk. However, triglycerides tend to be higher after meals, especially if you've eaten foods rich in fats or sugars. Because of this, doctors sometimes prefer fasting tests when they need the most accurate triglyceride levels. In non-fasting tests, measuring non-high-density lipoprotein cholesterol is common. This number includes all the fats that can clog arteries, like remnants of triglyceride-rich particles. Non-high-density lipoprotein cholesterol is often considered a better indicator of cardiovascular risk than low-density lipoprotein cholesterol alone, especially when you haven't fasted. This makes non-fasting testing practical for routine checkups and follow-ups for people with high cholesterol. Fasting tests are still recommended in certain situations. For example, if someone has very high low-density lipoprotein cholesterol, usually over 190 milligrams per deciliter, fasting helps confirm the level. Also, if triglycerides are above 100 milligrams per deciliter, fasting can give a clearer picture. Doctors might also suggest fasting when evaluating metabolic syndrome, which involves several risk factors including high triglycerides. From a management perspective, non-fasting cholesterol testing makes it easier for patients to get checked regularly. It allows quick detection of elevated cholesterol and triglycerides, leading to earlier lifestyle changes or medication if needed. The results are interpreted using the same reference ranges as fasting tests for total cholesterol and high-density lipoprotein cholesterol. Slightly higher triglycerides or low-density lipoprotein cholesterol levels might prompt a fasting test for confirmation. Overall, non-fasting cholesterol results are a reliable way to assess your heart health. They help doctors decide if you need to make changes to your diet, exercise, or medication. Using non-high-density lipoprotein cholesterol as a marker in non-fasting samples is especially helpful for understanding your risk. This approach aligns with current guidelines that support non-fasting testing as a simple, effective way to keep track of your cholesterol and protect your heart.